All right, guys, so this is going to be the Chapter 11 review of the objectives. So the first three are all labeling. So if you, like I did with the heart, if you just print out a blank one from Google, or you take the picture from the PowerPoints, because those are going to be the ones most likely that you're going to see on your test, print them out, white out the spaces that have everything labeled, and just label the things that are listed in numbers 1, 2, and 3, because you're most likely going to have to do that on your test or your quizzes or both. So make sure for number 1, you can label the bones of the pelvis. So the sacrum, the ilium, the ischium, and the pubis. Number 2 is labeling the joints. So the pubic symphysis joint, where the two pubis bones meet, and the sacroiliac joints, where the sacrum and the ilium meet. And then number 3, you're just labeling landmarks on the pelvis. So the acetabulum, the obturator foramen, the ischial tuberosities, the anterior superior iliac spines, and the posterior superior iliac spines. So one thing I can tell you guys, when you're labeling anything on the test, it's not always going to be the exact way you look at it on the pictures. So make sure you're orienting yourself. Are you looking at this from posterior? Are you looking at this anteriorly? And go from there. So find something that you know is posterior. Find something that you know you can look at the picture and say this is anterior, and then label from there. Don't just label for memorization that, this is up top, this is on the bottom, or this is here, this is there, because if the picture is turned around or flipped a different way, that's going to mess you up. Number 4, it says correctly identify productive organs as female or male. So for this, it's easy to just make 2 charts. So for the male reproductive organs, you've got penis, scrotum, testes, prostate, seminal vesicle, and the ejaculatory duct. And for females, the uterus, cervix, vagina, ovaries, fallopian tubes, and mammary glands. Number 5, it says, for the following pathologies, discuss etiology, signs, and symptoms. The only thing there is pelvic floor incompetence and weakness. So for the pelvic floor incompetence etiology, it's from pregnancy, heavy lifting, surgeries to the pelvic floor, obesity, or chronic coughing. Signs and symptoms, this is something you really want to pay attention to, and know that these are signs and symptoms of pelvic floor incompetence. Urinary and bowel incontinence, and rectal and uterine prolapse. The prognosis, you can end up with permanent prolapse, or it can improve with meds, medical intervention, or PT intervention. For the medical intervention, you can have surgery, MRIs to see what's going on, and it's diagnosed through the exam of the pelvis. For these patients in PT, we'll use E-stem and biofeedback, resistance strengthening, weighted inserts for strengthening, and Kegel exercises. And then if you guys don't know a lot about E-stem or biofeedback, that's a lot that something you'll see once you get into the program. And if you have more questions about that, you can always get with Crystal, me, or Michelle, and we can kind of explain that to you more. Number 6, it says define the pregnancy-related terms. Primo gravida is a woman who's pregnant for the first time. Multigravida is a woman who's had several pregnancies. And multipara is the woman who's delivered more than one viable child. Make sure you guys can separate those, know the difference, write a short definition, because those will probably come up on your test. It might be something like a woman who's pregnant for the first time, and you're going to have to write primo gravida or match them, or write a small definition the other way. Number 7, it says briefly list and describe pregnancy-related conditions. Ectopic pregnancy. This is when the ovum is fertilized, but it never drops into the uterus. This could be very, very, very dangerous. Gestational diabetes that present during pregnancy that the woman didn't have before. A post-date pregnancy that's 42 weeks or more. Preeclampsia is hypertension and proteinuria during pregnancy, and the premature birth is anything less than 37 weeks. Number 8, it says listen, describe precautions and contraindications for PT during pregnancy. So the e-stim we were talking about earlier and diathermy, that doing that around the spine or abdomen while pregnant, definite contraindication. You don't want to do that. But if a patient has something else going on, like the ankle or the shoulder, then those things are okay to do, just not in the abdomen and spine area during pregnancy. Mobilization of joints is something you don't want to do because the laxity of ligaments, because the hormone changes in pregnant women. So we're not going to do any joint mobilizations while they're pregnant. And same thing, no hot packs near the lower abdomen and lumbar spine during pregnancy. But the same thing, if they've got something going on in the shoulder or the foot, you could do hot packs there, just not in the area where the baby's growing. Number 9, it says briefly list and describe complications of labor. The first one is a breech delivery. So that's when anything besides the head comes out, presents itself first. A cesarean section is this surgical removal of the fetus. The episiotomy is an incision to enlarge the vagina opening, which deters from tears, uncontrolled tears, because technically it's kind of an incision, it's kind of a tear, but it prevents more uncontrolled tears down the line. These can be varying levels. So the first is a superficial tear. The second is damage to the layers of the muscle of the perineum. The third includes damage to the sphincters. And the fourth includes extensive damage to the vagina, perineum, external genitalia, and the rectum wall. So make sure you guys can you can separate each level and you know what's damaged in which level. Number 10, it says briefly list and describe prostate diseases. The first one listed was a benign prostate hyperplasia. This is a non-cancerous, non-malignant enlargement of the prostate. Prostate cancer, cancer of the prostate, and prostatitis is a bacterial infection of the prostate. This is usually caused by a UTI or an STD. Number 11, it says describe how menopause can be linked to osteoporosis. So during menopause, the woman's estrogen levels drop. So then the bones begin to weaken, which can lead to osteoporosis. Make sure you guys can kind of think your way through that and answer that on the test, because I'm sure it'll be one of the questions. This is a shorter learning objective, so you're most likely to see a question about every single learning objective on the test. So make sure you guys aren't just listening to the answers, you actually know why and they make sense. If you have any more questions, like clarifying or anything, let us know. The last question on this one says, state the common site of pain referral for the male and female reproductive pathologies and discuss why it's important in PT treatment. So the common site of pain referral for reproductive pathologies is going to be lower back pain. That's where the site of referral is. And for PT, after a few sessions, if the patient's back pain is still persisting, it's kind of a signal that, hey, this may be a sign of a reproductive system issue rather than maybe what we thought it was at first, if their pain is not getting any better. Okay, guys, so that is chapter 11. There is only one more learning objective that is going to be on the midterm, and that's chapter 12. I'm actually going to do that right now, so you'll have both of these together. For your midterm, guys, make sure you're going back and looking at your old learning objectives, your old quizzes, questions you missed on the quizzes. Make sure you understand why you got them wrong, what the right answer is, because that's going to help you out a lot on the midterm. They're not going to throw new stuff at you, that you haven't seen, except maybe chapter 12, because I don't think you guys take a chapter 12 quiz before then. So you're going to see some of the same questions, not the exact questions, but relating to the same things, maybe worded just a little bit differently. So if you got it wrong, make sure you know why it's wrong and what the right answer is, so you don't miss it again on the midterm. And like I said, make sure you guys are studying the older stuff, like chapter 1, chapter 2, stuff you haven't seen for a few weeks, because that's going to be on the midterm too. And from what I understand, your midterm and your finals weighted really heavily, guys. So don't take it lightly. Make sure you get your studying in. And if you do have any questions, I should be at the school the rest of the week except Thursday, but I will be available. My email was linked to the first quiz, so if you guys have any questions, make sure you reach out to me, Michelle or Crystal, before your midterm next week, guys. All right.